Nigeria, coming at you today with another video. To those of you who have been following my journey this entire time, I just thank you so much for the love and the support. I love when you guys reach out to me. I love interacting with you guys. To those of you who have just reached out, let me know that you have passed your HESIs. Congratulations, and I can't wait for the update letting me know that you filled out your nursing school application and you were accepted. To those of you who are just now joining my channel or just stopping by, I thank you so much for even clicking on my thumbnail. I hope that you like the content, and I hope that you go ahead, like, subscribe, comment, and share. And as usual, you guys can always reach me at ALWAYS.NYGERIA@gmail.com. That's always .Nigeria@gmail.com. So here's my little mini, excuse my kitchen. Say hi.
Hi.
So y'all may hear her in the background. My daughter's up. I was just trying to do a quick update. I am sitting here making breakfast, and I'm going to be cleaning my kitchen, so you guys have to bear with me. I am making pancakes and like scrambled eggs with some sausage. Well, the sausage won't be in scrambled eggs. It's actually going to be like, I don't know if you guys have ever tried like potatoes with onion, peppers, and sausage. So I'm doing some andouille, like spicy sausage, and I'll be putting some potatoes in and mixing some onions and peppers in, and then of course I'll be adding in my own seasonings to make it even spicier. So I'm doing that in substitute of doing like bacon and regular sausage on the side. I'm just gonna incorporate the meat into the potatoes, and the scrambled eggs will be, there, and then you'll have pancakes as well. So yes, that's what my family will be having for breakfast. I'm kind of late making breakfast. It's like 12 o'clock, but whatever it is, what it is, at least they eating. Yeah. So as far as school goes, I had actually made like a video in my car. It's a car chronicle. However, I did not upload it. I was going to incorporate it in this video, but I think that I'll just discard that information and I'll just talk to you guys in this video. So as far as nursing school goes, to those of you who are new to my channel, I am a second semester nursing student. After this semester, I'll get a break for a few months, like from May 11th to like the end of August. So I'll be out of school then, but then when I go back, I'll be a second year student. So my program is only 2 years, so then I'll have third and fourth semester and I'll be done. So my estimated or expected graduation date, if all goes well by the grace of God, will be May of 2021. So yeah, I'm headed into the third week of the second semester. So as y'all know, or if you guys don't know, I was supposed to be starting a new job. I was going to be working full-time as a PCT. I was really excited about it. My start date was supposed to be February 10th. But my date got pushed back because I couldn't attend the orientation. Like, I needed to leave early 2 days so that I could make it to clinical. And then the third day I was going to need to leave for a little bit to go take an exam at school. And then I was going to go back. So my boss contacted me and she said, we'll probably be best if I start in March, because then they'll have like a weekend orientation type thing. So yes, now my push date is pushed all the way. My start date is pushed all the way back to March. But it is what it is, At least they're holding my position. They know I'm a nursing student, so kind of scheduling me for like daytime stuff is difficult. They know that that's expected with a nursing student. If you're going into like a healthcare field, they kind of work with you a lot of places because they know how the scheduling is with a nursing student. That's why I'm working midnight shifts, so that I don't have to deal with any scheduling conflicts. Now, with that being said, the first week was really uneventful. We went back the 21st. Martin Luther King was the 20th, so we didn't go to school that day because obviously there was a holiday. The second day was the 21st, and I was supposed to be going straight to clinical. However, there was some type of mix-up with paperwork and things like that, and my school contacted the ones that were in my clinical cohort and told us to go to the school. So we ended up spending one clinical day in the freaking skills lab, just going over book work and things like that, which was kind of annoying because it's like we're past first semester. We're supposed to be, we're not supposed to even have to ever really come into this lab anymore. We just go to the hospitals and work our clinical. But for some reason, they thought that we needed to go there to do training for the computer system at the hospital that we're at, which ended up being inaccurate. So obviously that was one day of clinical we missed. But they're not counting that against us. They're counting that towards our clinical hours. Thank God. Another thing is, Wednesday we were supposed to have lecture, but the instructor was out. He had the flu. So that was a day of lecture that we missed. So as you guys know, I'm only in school this semester, or this first half of this semester, Monday, Tuesday, and Wednesday. Monday and Tuesday I have clinicals from 3 to 9:30, and then Tuesday I have class until 4:30. So and then Wednesday I have class until 4:30. I'm sorry. Monday and Tuesday clinical 3 to 9:30. Wednesday is class until 4:30. Okay, Thursday, Friday, I don't have anything to do until I start working, and then I'll be working from 7 p.m. to 7:30 a.m. So anyway, then we had a few days off. So then Monday came, we were going to clinical, and we had to do Epic training because that's the hospital that we're working. Put that up. The hospital that we're doing this clinical rotation at, they use Epic computer software. So we had to do an entire day of training. Like, this training was literally like 5.5 to 6 hours long. So we stayed in one computer lab and we set up and did training all day. So we were done with that, and then the next day we went to clinical. It was Tuesday. We went to the unit or whatever, a med-surg unit, of course, and we were just shadowing for the first day so that we knew where things were. We knew how that specific unit did their thing or whatever, so that was fine. We were able to shadow. The nurses were pretty nice. I did see some very interesting things actually the first day, some things I've never seen outside of a book, so that was nice. What I don't like about this clinical rotation is that we have to get there really early because we don't park at the hospital. The staff doesn't park at the hospital. They park at these different parking structures. So we literally have to park like at another structure. We get picked up by a shuttle that makes multiple stops, and then they take us to the hospital, which is annoying because if you try to get to, like, if I was just able to park at the hospital, I could get there at like 2:45, 3 o'clock, or 2:45, 2:50, so I could be in the lobby meeting with my instructor by 3. But no, since I have to take a shuttle, we have to make extra stops, and the shuttle only runs every 20 minutes. So like I have to get there no later than like 2:20, because it takes about 15 minutes for the shuttle to get me to the hospital after making its stops. And then I have to walk from the back of the hospital to the front of the hospital. That's about another 5-6 minutes, depending on how fast or slow I walk. And then I meet the instructor. So that's kind of annoying because it's like, ain't nobody trying to do all of that. But we have no choice because they said that we would get in trouble if we were caught parking at the hospital because the staff doesn't park there. So that sucks, but it is what it is. So now we go back tomorrow because today's Sunday. We'll be going back tomorrow, and we won't be shadowing. We'll be, back to the usually scheduled program. We'll be passing out our medications. We'll take over a patient because we don't get like 2 patients to ourselves until like 3rd and 4th semester. That's when we get multiple patients. But during 1st and 2nd semester, you only get like 1 patient. So we'll go there. We'll go to our pre-op conference meeting, whatever you want to call it. We'll be assigned to a nurse, and then we'll go to that nurse and we'll see who that nurse has as their patients, and then that nurse will give us a patient. We'll report that to our instructor, and then from that point forward, we're solely responsible for that patient's care. We go in, we introduce ourselves, we do our primary little assessment. We typically, how I like to do things is once I get assigned my patient, I typically go on that patient's chart. I go through the medications. I go through the last progress note. I look at lab values. I see, of course, why the patient is there, what their chief complaint was versus what their diagnosis was. I see what the plan of care is and things like that. I'll also look at the last vitals, and then I'll actually walk in the room, introduce myself as the nursing student that'll be taking care of them, ask them if they have any questions and things like that. I'll go ahead and get my own vitals, write those down, of course. and then I typically leave out. The only thing is, you know, when you're in the chart, you have to look and see what time they need medications. So like if your patient needs medications, you don't like just not give them. You write down what time they need them, then you go find your instructor who has to get the medication for you, and then you go and you give the medication. Of course your instructor is sitting there monitoring, but you know, you give that medication, whether it's an injection, whether it's insulin, whether it's pill form, whether it's through the tubes, because you know, some patients may have NG tubes, some patients may have PEG tubes and things like that, whether you have to do like a, you know, that type of feeding. Yeah, so you'll do that. You don't necessarily have to continuously get your vitals. Like, you can always have the CNA or the patient care tech get your vitals and report them to you, and then you can put them in the system. And so you can kind of play that how you want. If the patient says that they want to be like changed or need to be changed as far as like their bedding and things like that, you can either relay that to you can go get your CNA or your PCT and have them do it. But me personally, I like to help them do it. I don't want to give them all the work because I don't mind, you know, helping with my patient. Also, you'll want to make sure that the patient is not nothing, you know, NPO. You'll want to know when they last ate, just in case they're diabetic, and you know, or you know, you have to know about the medications and what the restrictions and things like that are. So like if they're supposed to eat while they're or before they take the medication, or if they're supposed to eat or not supposed to eat before they take the medication, you have to be very mindful of that before you're just going in there all willy-nilly and doing things. So while you're doing that, hold on, I'm sitting here boiling these potatoes. They're the little baby ones because I don't like them to take forever. I think they're about done. I'm gonna give them like 2 more minutes. So then I can cut them up and I can put them in my sausage. As you guys can see, the sausages, they're nice and crisp. I'm just gonna cut up the potatoes, put them in there, cut the onions up, throw that in there, some peppers, throw that in there. And that'll be like, and it'll like all mix in, and I'll throw some seasonings in there, and it's gonna be great. And then I'll do the pancakes and the scrambled eggs, whatever. But I try to get this out the way because it takes the longest, especially because of the potatoes. Okay. Anywho, back to what I was saying. So with that being said, it typically is, it's fun. You can or cannot do a lot of running. It depends on what your patient is there for. Like, I know I've had patients where I really just didn't have to do anything for them. They were really stable. I might have had to pass a medication or whatever, and that was it. But then I've had other patients where it's like they have a PEG tube and they have oxygen and they have all these restrictions as far as activity. So I have to help them to the bathroom, or I have to monitor their input and output, or I have to they need to get vitals every 15 minutes because they're not so stable. So you really never know, and it's case by case, patient by patient. So, you know, once you get in there, it is kind of overwhelming, but you'll get it. Like after like the first 2 or 3 patients, you'll get it. So that's that. Now, as far as homework goes, I thought that this was going to be a lot less homework because we only had, versus last semester I had 4 theory classes. I had 2 clinicals, or sorry, 1 clinical and 2 labs. So that was like a lot of class. This time around, because I'm second semester, we literally have the first 7.5 weeks, 1 theory and 1 clinical. Then the second 7.5, we go to a different theory and a different clinical. So my second 7.5 weeks, I'll be going to OB. So I'll be at a whole different hospital and everything. But it's a ton of work, and like basically it's all building on what you learned from last semester. So the lab values that you learned, whether there was like 100 lab values, you're now getting another 60 thrown at you. You know, wound care, you know, the basic wound care that you learned, now you're doing intensive wound care, and things like that. So also, like, as far as the book work goes, like basically you're held to the standard of what you were taught. So if you were taught X, Y, and Z in fundamentals and physical assessment, they expect you to actually know that stuff when you get into this part, because if something goes wrong, you're going to be held to that standard of what you were taught. So you can't learn just to pass. Like, you actually have to know the information, and that's what I'm having to like really sit down and think about, because like I said, there was a lot of labs and there was a lot of stuff going on last semester, and so I have actually forgotten some of my lab values. So I need to sit down and go over them and really stick them to my mind, because there's things like for your testing that you'll need to know those lab values. They're very important. Also, for this instructor, he does a lot of talking. So I recorded his lecture. I'm actually going to sit down and take some notes from it today, as well as print off some of the things that he has posted, because I've posted on Blackboard, because I was told by students who've passed this class that a lot of the information he uses doesn't come out the book. It's from his own lectures, and he posts like a lot of stuff on Blackboard that you need to look at, and it's very helpful to passing his exams. So what I'm going to do is actually print that stuff out and put it in a binder, the binder that I showed you guys in one of these videos. And just, I'm going to highlight and take notes from there, or just add my own notes to help me like memorize, or not memorize, or, you know, learn the information better. So that's that. I have completed every single HESI case study, because as you guys know, and if you don't know, last semester, the last half, I was telling you guys how I got so overwhelmed with the amount of work that literally I put off the HESI case studies and the prep use, because my other instructors were allowing us to have to the week prior to the last week of class to get them done. Like, there was no specific due date other than the week before the last week. These last two instructors that I've had, the one from pharmacology and this one for MedSurg 2, they have specific dates where they want this stuff done. So it's like a lot, because you already have a lot of other homework and you're already studying for a lot for the exams. So I just went ahead this weekend and I just knocked out every single HESI case study. So that's one thing I don't have to worry about for the remainder of these like 4.5 weeks. I've also completed the 3 prep U's that I needed to have completed by the 5th. So I did those 3 already. What else? Oh, I'll update you guys with the type of assignments that we have. We have some medication assignment that's even longer than the medication assignment that we had last time. So I'll update you guys once I start doing that. Of course, we still have like the Gordon's assessment and the care plan and all of that stuff. So yeah, really, that's all I needed to update you guys with. I'm gonna go ahead. Yes, I'm just gonna go ahead and end this video here. If you guys have any questions, or oh no, I'm sorry, before I end this video, I have promised you guys I will do some dosage calculation segments, which I promised to get out. Hopefully I'll have one for you guys this week. Also, the math for us is getting harder, so I need to actually learn that math as well. So that's kind of where I'm at with it, because my first dosage calculation exam for this semester is on the 19th. Luckily, we only have one dosage calculation exam each semester now. Well, for this one, and then my last dosage calculation exam will be 3rd semester. We don't have one in 4th semester, thank God. But you know, you get 3 attempts, because you have to get a 90%. That means you only can get 1 question wrong. So I'm gonna pray that I just get the 90% on the first go round, because I'm not trying to go 2nd and 3rd round, because you know, if you don't pass the dosage calculation portions, then you fail the semester no matter whether you're passing the classes or not. Pick that tablet up, whether you're passing the classes or not. So that's something that I'm really fearful of. So yes, I have to go ahead and make sure that I'm good on my end with learning my own information, and then I'll also help you guys. But I can't like sit down and do some of these videos like with the amount of time it takes. But I do promise that hopefully this week I'll have a video of me working out some dosage calculation problems, and then I'll even start helping you guys with the ones that I'm learning. That way you can get like a heads up, because it's like they're adding in dopamine. So if you guys want to like look at other videos, they're adding in dopamine drips, and I want to say I don't remember the other one though. I'll have to look at my paperwork. But anyway, yes. So now I'll end the video. Thank you guys so much for coming back. I'll continue to update you guys with my progress. Once again, continue to update me with yours. And I am out.